Welcome to another episode of Come Together. We're live. Welcome to another episode with Dr. Sharafsaleh. Thank you so much for coming. Thanks so much for making this happen. I'm really excited to talk to you.
Thanks, Ephraim, and you said my name perfectly. So happy to be here.
Yes, I kind of bailed on the first name. Ganush?
Golnosh?
Golnosh. Close. Okay.
Yes.
I almost got it.
Yeah.
Where are you from? Where's your family from? Or your husband's
It's like
family?
a traditional Persian name, like
Hmm.
Iran, where all the conflict is going on now. But like a Persian kind of Zoroastrian, I guess. I don't know. So,
Cool. Okay.
and
I love it.
tomorrow's like the
Love it.
new year, I guess. So we're going to eat fish. So that'll
Oh,
be
is
nice. Yeah. Yeah.
what's the celebration usually like for New Year?
So Gosh, I'm so ignorant. Well, let's see. So it's kind of, I think, originated from like this Zoroastrian holiday where it's spring. And so it's the beginning of like new comings and new beginnings. And you set up this table, which is sort of like a Christmas tree, but it's not a Christmas tree. And there are different symbols on it. Like there's a mirror on there and there's greenery, which represents like, is that fertility? Or there's like coins, like gold coins on there, which represent like fortune and various things. And so my mom's very good at setting this up, and then my sister and I will go to her house with our kids and family, and then my dad cooks because he's an excellent cook, and that's as far as I celebrate.
That sounds
We
perfect.
celebrate, like, all the holidays. It's kind of interesting because my like, Christmas, and then my sister's, um, like, Russian Jewish husband, so we have, like, that whole thing. We just celebrate all the holidays. It's kind of fun that way, but
Mhm.
yeah, tomorrow
It's
happens to
I
be this one. It's nice.
it's the best to do that, yeah, I think. It's cool. It's very cool.
Yeah, we like it. We like it, you know, so
So, I'm so excited to talk to you about so many different things, and you got a lot of fun things to say about a lot of different things. So I'm excited to dive into this with you. And what kind of caught my eye originally when I found your profile on Podmatch was a combination of geriatric care, dementia, and then lifestyle health. And I thought that was really great because one thing that has been consistent, I think, over the last few years is a lot of people have been talking about how lifestyle let's say rather health helps you age more graciously and more, and a little bit more forgivingly, I would say. And that's something actually I have been arguing with my dad and bickering with him about. My mom takes excellent care of herself. My dad is a little bit less so, and
so he's not
you know, and
thriving. He's not thriving in his old age,
uh,
is that
no,
is
no,
he
no, I don't.
thriving? He's
Not
thriving?
physically, not physically, not
Okay,
physically. He's
okay.
thrived more physically. He's been in better shape, but to be fair, he's almost 60, and, when you haven't exercised in a little while, it's hard to snap yourself into a new habit, I think. Um, but that was really, so that really caught my attention, and then when you and I spoke, we talked about some heavier things that I think that we should talk about too,
Okay.
and, in your book, and I kind of wanna just I'm more interested in learning from you and hearing what you gotta say, so I'll kind of just direct your thoughts and just, I would love to dive into it.
Sounds great. Okay, ask your first question.
So, let's hear about I'm really curious about the early signs of dementia/Alzheimer's and ways to recognize that in people and ways to recognize that in family, and I think and Alzheimer's and dementia in general, I believe is much more common now than it was 20, 30, 40 years ago, and, and if there's anything that we could kind of do to be preventative about it.
Oh, yeah, there are things. So here's the thing, number 1 risk factor for Alzheimer's is age. So, there you go, and we're living longer, and I joke about this with my patients, but in reality, if we think about evolution, like, nature tries to kill us off as soon as we've, like, procreated and we've raised our young, but, if we think about our lifespan, we think of it in, like, childhood, adulthood, and then our elderhood, and so that last third of our life shouldn't be where we're sick. In our childhood, we're just learning to figure life out. In our adulthood, we're like taking care of everybody, trying to basically just survive life. And then in our elderhood, this should be a time of reflection. It should be a time where we have a good health span. We can see the world, um, embrace like the things we didn't get to do because of all the things we had to do in our adulthood. And unfortunately, one of the things that happens is people develop chronic disease, like they have like more comorbidities, and they end up
Mm.
losing their independence. And so I think as a geriatrician, so a doctor who, pediatrician, geriatrician is a doctor who practices um, aging. My focus is always like, let's keep people independent and let's keep them cognitively sharp. Because I truly believe that even if physiologically we develop deficits
Hey everyone, real quick, if you're enjoying the show, click subscribe and rate the show 5 stars. Helps a ton. Thanks so much.
in older age, if we have our mental health, then that will still keep us independent. We can still
Mm.
narrate our life versus if we don't have that. People who have dementia, these are the individuals who end up in nursing facilities. These are the individuals who end up being taken care of, and maybe um, their goals and their wishes are not honored just because of like their care needs. And so that is constantly what I think about. And one of the emerging areas of medicine is to really try to detect signs early. Dementia and signs of cognitive loss, they start decades earlier than before we actually have cognitive disease. So around 10 years ago in my career, when I was first really treating people with dementia, family members would bring someone in who had some memory issues, but by then their disease was like in a moderate stage. So there wasn't much to do, unfortunately. Now people are coming to me themselves, like earlier on, and they're like, hey, I'm noticing that I'm having trouble with words. I'm noticing that it's taking me longer to learn things. I'm noticing that I'm having trouble with names. And my first question is always, has this always been the case? Because if you're someone who's been bad with names forever, okay, that's fine. Like, hey, buddy, this has been your norm. That's not cognitive deficits. But if you are like, I was great with names and now I'm forgetting names, there's an issue there. Or if I walk
Yeah.
into a room and I can't remember why I walked in there and this is not my baseline, then there's a problem here and we need to think about it and we need to screen. And so this is where I start screening people, and some of our common standardized tests are only standardized to like an 11th grade education. So then you have people
Mm.
who have a higher education than that, and they can compensate for those, and their primary care doc might
Yeah.
just say, "Oh, you're fine. There's nothing wrong with you," when something is brewing. So really keeping track of those minute changes that occur that are not your baseline. I think that's where something needs to um, like happen. And one of the things you can do is if you don't have access to a geriatrician or a neurologist, your primary care doc can refer you to a cognitive psychologist. They can do a battery of neurocognitive tests and try to weed out like, hey, what areas of cognition do you have deficits in? And do we need to do something about it? The cool thing is you can actually work on your brain and different areas of cognition. I mean, often send people to cognitive rehab so that they can work on areas that they're
No.
struggling in. They get better.
What
You
does
didn't
it
think of
look
that.
like?
Mhm.
What's cognitive rehab look like? Or what's a
Yeah,
day in
so,
that life?
you know, um, just like people get a prescription for physical therapy, like let's say you get a shoulder replacement or surgery or hips or knees, and you go to physical therapy and they lay out a plan for you. We're going to do this and this and this for this length of time, and these are your goals. Cognitive rehab is generally done by speech therapists. They have additional training and they will set up a goal. So they have initial cognitive assessments, and then they're going to say, we're going to improve on working memory and on delayed memory. And we're going to work on executive function and orientation and task management. And they will work with you and you improve and you meet your goals. And then you continue with those things. So, uh, there's opportunity there, and I think people don't even know about it. I mean, when I have patients in my office who come in for a cognitive assessment and I tell them, "Well, I think we should send you to cognitive rehab." Like, they ask me the same like, "What is that? I've never heard of it." Not very many
Yeah.
people even know it exists now.
It's a shame,
So
by the way, and there's a lot of different types of cool rehabs that exist that, I think if not for a little bit of stigma that we could really take a lot of advantage of. I just did a episode yesterday with a neurologist and physiologist who part of what she researches is music in the brain and using music to, for to help with with different potential diseases as far as learning or as far as even I've read other accounts of playing music having a huge impact on neurodegenerative diseases like MS or Parkinson's or Tourette's or I mean a whole there's a whole library of potential neurodegenerative disorders that are really that could be helped with music. And how many people think to just play music as a when you're diagnosed with MS or Parkinson's, God forbid, you know?
right, and even, like, when we think about dementia and music therapy, sometimes what's fascinating is I'll have a patient who, forgets everything, but you put them in front of their piano, and they used to play piano forever, and they will just, like, start playing, and
Yeah.
for a moment, you have that person back, and it's pretty fascinating.
Right.
It's
It's amazing you say that. I dated a girl for a bit, and her mother, while we are going out, had this disease, and I think it was very, very hesitantly diagnosed as Parkinson's,
yeah,
because some of the symptoms matched up with Parkinson's, the freezing up, but there were certain things that didn't exist. She didn't really have the tremors quite in the same way as I've seen a lot of other Parkinson patients. They weren't sure really, but one thing that did happen was she did play piano and the accordion growing up. And so
yeah,
while we were going out, if we'd ever go over and anyone was playing music or she decided to ever like pick up something, you could see that, like, her whole body would loosen up, or we'd even play music and she'd start dancing, and she could dance even though some
fluid.
moments ago, really frozen up. It's crazy. I mean,
It's
it's
incredible.
incredible.
It's incredible, and sometimes, like, in terms of I mean, you had this the whole episode, but this, like, neurodegenerative disorders, like, with lasers and music, like, how different parts of the brain will activate, and then you stop
Mhm.
that freezing, and all of a sudden, you have a fluid movement. It's amazing because I'm like, "What is our brain capable of?" And even in the midst of disease, how can we retrain our brain, and we're not using every part of our brain that we need to use. And this whole concept of neuroplasticity is it's a new emerging concept. Like when someone has a stroke or when someone has some type of an insult to their brain, how can we learn to rewire and rehone and learn the skills that we had and learn to move the way we used to? uh, so I think
Yeah.
neurology is just a fascinating emerging field, especially as far as, dementia goes. I think that's where I'm so interested because I'm like, if I can preserve the brain and preserve independence, that's all I wanna do, especially we have dementia in my family, so I'm, like, always like,
Mhm, me too.
I have a personal investment in this. I tell
Yeah.
patients, like, "I am invested in you, you're my patient, I care about you, but I'm also personally invested in this. I wanna figure out any new emerging therapies out there, and I wanna be able to, implement them if they're appropriate for you." So,
Yeah, for
yeah.
sure. One of the really incredible I've spoken to this a lot on my podcast in different applications all across different, like, worlds, but one thing that everyone talks about recently is the fact that institutional trust has pretty much collapsed since COVID, and there's a million different reasons why and a different million different applications, and, whatever it may be one way or the other, one of the benefits that I really strongly believe in is that it kind of encourages more open-mindedness and more play and more figuring new things out that, like, we were so set in our ways, it felt like forever, even though, I mean, again,
Yeah.
in the concept of history, I mean, you talk about being from, Persian and, like, how,
Yeah.
hey, I'm American, 250 freaking years old, that's it, I mean, like,
Yeah.
we figured everything out, and hey, there's a lot of wisdom out there. There's a lot to learn, and there's a lot to figure out, and sometimes it's good for institutional trust to break just for people to kind of feel like, "Hey, you know what? If I don't know what the doctor in Harvard said, then, like, let me try this music therapy. Oh my god, it works. Like, that's incredible." Like, like, okay, so then someone in Harvard will
Yeah.
pick up therapy and get into it. So I think that's really I think that we're at an exciting time. I'm really excited about what we could be accomplishing.
Yeah, and you're totally right as far as um, I think just opening our mind to not just practicing medicine or living our life based on a set of beliefs or set of standards when it comes to even, when it comes to health. I have a patient. I recently, this is a funny story. Just this past week, I recommended they have acupuncture, and they were like, isn't that more of a placebo thing, for the thing that they
Mhm.
had? And I, like, sent them a bunch of papers. And this person, has a background where they understand research and paper, and I'm like, "Actually not. There is a lot of data behind it." And here I am as a medical doctor, and, occasionally I'll send I'm like, "You should see a chiropractor for this," or, "Let's try this supplement for this in addition to this medicine for this." And they're like, who are you? And I'm like, you have to kind of embrace all of it. I am a medical doctor, but I think, like, if I just stuck to these standards, then I'm not going to give my patient the entire, like, pot, of everything that they could possibly benefit from. So, I do take a very holistic approach when it comes to cognitive health, not only as far as thinking, okay, let's detect cognitive impairment, but then let's talk about what are these other factors that could be causing progression of your cognitive impairment. For instance, like
Right.
diet, I work with people on their diet and really focus on like a diet that like kind of a mind diet, sort of a keto flex diet where their brain is also benefiting from that and they're not having like glycemic index issues. I focus on blood pressure control, sleep apnea, exercise. I mean, exercise is like a huge part of what I do with my patients. And then in my office, I use this scale called the InBody scale. I don't know if have you heard of it.
No, tell me about it.
People talk about it. So I don't even want to talk about it because I'm a little bit like hurt. But like Peter Attia, he was all over the Epstein files, but
Uh,
his book was good.
yeah.
Outlive was a really good book,
I
but he
I was
talks
about to
about
bring
the.
it up, by the way. I was
I
gonna
mean, I
say,
was like, I was so sad. I read the book 3 times and I, like, preached about it, and then all of a sudden, my partner was like, "Did you hear what happened?" And I'm like, "Oh, crap. Is it every man? Is it every single man?"
it
But anyways, it was still a very good book, and, but the in-body scale doesn't just look at your weight or your BMI. It actually looks at your skeletal muscle mass, it looks at your percent body fat, and for my patients, again, as you're aging, I don't want people to get frail. So I'm constantly like, all right, are you doing the exercises we're talking about? Are you building muscle? And all of those things, you know, managing the body holistically is protecting the brain essentially. So I do that,
it's aw it's
Yeah.
awesome. I actually so it's funny you actually bring that up because I sell medical equipment on the side, I actually
Yeah.
as a not on the side, as a living, and one of the big things that have been very popular now are bone density machines that people are buying for whole body composition and body fat composition, and someone calls me up in Austin, Texas, a couple of months ago, tells me, "Hey, I wanna buy this machine." I'm like, "That's cool," and he goes, "Yeah, if you give me a good deal, like, I'm buddies with this guy, you heard of Dr. Peter Attia?" And I'm like, "Yeah." And then I'm like he's like, "Yeah, and we're trying to base our health model on him, and by the way, like, man,
I
do you
know.
consider that to be like a case of separating the art from the artist? Or like,
It's
like where you say,
so
"Well,
hard.
science is the
Yeah.
science and the dude," and like, like, what do you say? What do you do about that?
Well, my sister was said that about Kanye. She's like, you gotta separate the artist. I was like, all right, all right.
Yeah,
So it's still very difficult, because I think as a female, a physician, and it was like
sure.
I was just so disappointed,
Yeah,
and
yeah.
my partner was like, "Do we burn the books? Because we have a little library." And she was like, "But we're not book burners. Are we book burners?" No, but but I do think there was
Every book by every creep that was out there, then we would not have a lot of
we would be
literature
burning
left.
every book. Yeah, but
Millions.
really the concepts, make sense in that book. And I did, I think, develop a lot of my thoughts as far as and sort of I adapted a lot of things there, but it was only like in one realm of my like health framework that I use. You know, when I see people in aging, I call it I was like, it's the art of health span. So health is this acronym where the H is, you know, like how we age, and then the M's of geriatrics, which I think are for not just the geriatric population, but they are relatable to everyone, which is like, so what matters to you before I even treat you? Like, I shouldn't just do all this medicine. I should understand what actually matters to you and then what your
Mhm.
mindset is at. You know, is it a mind disease or is it like your mindset, your multimorbidity, the medical problems that you have, the interactions between them, the medications, and then your mobility, keeping you upright. And then the E was it's energy from a cellular level to disease specific level that are energy dependent. And that's where like Peter Attia was talking about, you know, some of the energy dependent diseases where you think about cardiovascular disease, cognitive
Mhm.
disorder, cancer, metabolic disease. Well, that's just like in the
Yeah.
E, and then the A is for activity and how our bodies are like meant to be in motion and not like going to the gym, but what do we want to be able to do and our reserve and capacity. The L is the longevity piece. So then, you know, those pillars of lifestyle medicine like social engagement, diet, sleep, you know, those pieces. And then the T is for transformation and how we do transform. So like, you know, these longevity people that I'm sort of I think I stand outside of their realm is like, no, we are supposed to age and our life is not supposed to be forever. And so then how do we adapt to that transformation? So our adaptation to change so that we can live fully and have the best quality of life possible. And the last H is habits. And something I used to always say, and everyone's like, where did you get that? And I'm like, I don't know. I pulled it out of somewhere. But I used to be like, what's the reset technique? So I guess nobody like had used it before because I ended up buying the domain. It's mine. I don't do anything with it. But
Got it.
anyways, but it's like these
That's
incremental
fantastic.
changes, you know, our life moves along and our habits, like you walk into a room, you flip on a light, that's your automatic habit. So how do we build our small habits into our life? Kind of like Atomic Habits. That book is a fantastic book. But then, you know, we can't maintain our habits all the time because life happens. So how do you have these like small incremental resets so that you can sort of pick up and just redefine yourself again so that you're not like giving up. You know, so I think I kind of see health in that framework and that's my approach when I take care of a patient. And surprisingly, my patients are like super motivated. Like they come back and most of them are doing amazing. You know, they do all the things and it works. So, when they do all the things.
I would guess that part of the reason why they do so well is because I think that for a lot of people, if you're getting treated, you are receiving something and you expect and your role is very passive. And with a lot of lifestyle type of medicine, you're putting the person's decision making in their own hands and saying, "Hey, if you want to be healthy, you need to sit down and stand up 3 times a day." You know, if you want to be healthy,
Absolutely.
yeah, walk up and down a flight of stairs, and to say, "Hey, this is in your hands. I can't force you to do it, and you will see that you'll feel better if you do it." But, like, I think that when you give people license to take care of themselves and you say, "Hey, there's a very tangible playbook that links your movement with with your cognition. Let's
Yeah.
be on top of that." And, like, they'll say, "Hey, if that's all it takes and that's all and I didn't realize that, then let me keep on doing it. That's awesome." You know? Um,
Yeah.
yeah.
I think in some senses though, you know, like sometimes because I do have elders, most of my patients are elders. I have a few like in their 40s and 50s who came to me because I took care of their parents and they're like, they're doing better than me. Will you take me on as a patient? So now I have like these young adults that I don't like. I'm like, oh my
That's
gosh,
good. That's amazing.
this is fascinating, like new area of exploration. But sometimes my elder patients are like, oh, you don't know, like you don't know what having chronic pain is like. I'm like, oh, but I do, and I tell them,
Yeah.
I'm like, I had both my hips replaced like literally a year ago. And they're like, you did? I'm like, yes. And I was limping and I wasn't sleeping. And it was like 3 years of no sleep and chronic pain. But I did what I needed to do, and I was just unfortunately, like, born wrong like a dog, I have dysplasia, but you move on, or they just, like, they don't get it, like, I share my personal stories with them, which I think help them to see that I'm also human, so I sometimes take this very non-traditional approach to medicine, which I think we also need to think about as physicians, like, I made a house call the other day because the patient had surgery, and when I got there, the dogs needed walked, so I ended up, like, walking the dogs. There were these cute little puppies, and, I met the neighbors. I'm like, "Oh, I'm the doctor." But, you kinda meet your patients where they need to be. Like, I mean, that's, like, a very drastic example, but you need to meet your patients where they need to be. They need to see the human side of you, the imperfect side of you, so they can be like, "Alright, this person doesn't know," or, like, it's okay, like, they're not perfect either. So I always remind them how, um, abnormal and inadequate, and, I tell them about my failures of, like, the nighttime I get up and have a little piece of chocolate, and then I have to reset again, like, "What did you just do?" But I think that's the other part of medicine that's important, just the human part that will
I
help our
think
patients succeed.
for sure, for sure. It's very interesting that you bring that up because there's 2 things there's 2 responses I'd love to hear your thoughts to. The first part is, I'm reading a book now called, Empire of Pain, and it's about the Sackler family and painkillers and Purdue
Yeah.
Pharma. Um And one thing that Arthur Sackler who's I guess, the leader of the Klan and,
Mhm.
the father of the family, so to speak, was famous for was he kind of linked advertising and the public's perception of MDs and doctors and and sold that as a package to the American public and said, "Hey, doctors are not wrong. Doctors are above people. Doctors are always right. And we, in our medical sense, are only trying to achieve the highest truth, which is scientific truth and rigor, and basically use that as a method to get away with selling, incredibly, incredibly addictive painkillers as stronger than heroin for decades, right? Uh,
Yeah.
and on the other hand, and on the other hand, my grandfather, who's a gastroenterologist for 50, 60 years in Miami Beach, he has lifelong patients, and he was lamenting to me how the new hospital systems that have taken over that are buying out private practices don't allow a doctor-patient relationship essentially, and that you're basically not encouraged to ever kinda like, whoever you walk into the room is who you're dealing with, and then you walk out of the room and you never deal with them again. And he's like, I used to check in on my patients on a daily basis, and they would call me and they'd tell me I'd saved their lives just from being their doctor, not from their being their GI, from being their doctor. So, like,
Yeah.
you have 2 extremes of the way that people could treat being a doctor. You have, like, the Sackler type of family that just, holds himself as above everyone and wants to take advantage of the rest of the mortals down here. And then you have the doctors that are doing the work of caring for people, and again, I think that there's a misconception today or maybe a reconception of a doctor as someone that just tells you what's wrong with you, and the primary purpose is diagnosing, not as much preventative and not as much, the building up and the lifestyle aspect that you're referring to. But I hope that with technology and AI, it's gonna be easier for people to become more have a personalized form of healthcare for sure.
Yeah, I think that's kind of what healthcare needs to be. Like, what is it that you want me to help you with? And that's really my question every time patients come in. I'm like, what can I help you with? What are you concerned about? And that's sort of where the approach starts. And then I also tell them like, okay, well, I've detected this and this. And I have patients who are like, I am not taking this statin drug. I'm like, okay, let's work on doing it another way, and we can try this, and, I really I guess that's the reason I left the corporate world, and, yeah, I know we were gonna talk about my book, but I always am like, if somebody in corporate medicine reads my book, they will never hire me in a hospital again because
Yeah.
I slam the hospitals, and, I was getting involved with administration. I was in a faculty, I was a teacher forever as a program director, and so I was getting involved in the with the C-suite operations a little bit, and I think once with one of the execs, I kind of really got into it, and I got home and I got really mad. I was like, "Okay," I told my husband, he's a physician too, he's a critical care doc, and I said, "Jace," that's his name, I'm like, "either they don't know what they're talking about, or I don't know, or they're lying to me, but I've only learned medicine and I have to figure this out. So I'm going to go to business school." And that's what we did. The two of us went to back to
No
business
way.
school and got our MBAs. Yeah, I was like for 3 years, we were full-time docs, full-time parents, and like our early morning study dates and our nighttime study dates. And you know what happens when a doctor goes to business school? The OCD and type A personality comes out. So you still get like a 4.0. And I remember I'm in business school with these other students doing projects and they're like struggling. They were just out of their bachelor's and they're like, "How are you? How are you not struggling in this?" I'm like, "I don't know." There's this like crazy comes out and I have to like prove something to myself. But what it taught me, what it really reinforced in me was that I can take my time with my patients. I can make money. I can be profitable. And one day, it was towards the end of business school, I walked into the clinic where I worked for this hospital. I turned on the lights, and I think COVID had sort of jaded me anyways, like I was
Mhm.
just like, this, something's got to give. This is not good. And I was doing a lot of palliative care consults. So I think emotionally, I was just drained being with people as they were dying. And I was like, "I'm keeping these lights on. Nobody else is. If I don't walk in here, like, the nurse doesn't get paid, the front desk
Mhm.
doesn't get paid, and and then the execs in the C-suite don't get paid, and they're taking my money. No one's gonna take my money ever again." So then I was like, "Okay, I'm gonna come up with this whole plan," and I left, and I called my one of my fellows, Kate, who's my partner now, and, I was like, "Hey, we're gonna do this. We'll open this practice, and either it's gonna work and it's gonna be great, or it's gonna suck and we're gonna just be employed physicians again. But either way, it can't be any worse than this." And it worked, and it's like we're looking at adding another physician now, and we're 5 years into it. Like we're both at our capacity for patients and it's been wonderful, but I get to spend an hour with my patients. I get to go to the hospital and see them, and I get to go to their home and I get to see them, and I get to be like the doctor I wanted to be and I envisioned, not like what they expected me to be, and that's so valuable. And I'm like, we need more doctors. And so now one of my motivations for having medical students is to show them that, like, guys, there are other ways to practice. You do not need to work for this institution. Unfortunately, that's the model. They teach us to be a commodity, and then the patient relationship goes away, and then patients suffer. People suffer
Yeah,
because of that.
people do.
It's awful.
Because you know what? You can't count health without relationships,
No,
because like, the worst thing that you can do to a human being, the worst thing they do to you in prison is solitary confinement, and, like and the worst thing that you could do to someone is to just take away their relationships, and people will, God forbid, kill themselves
yeah,
over relationships, like, you could have
uh,
all the money in the world, you could have all the comforts, you could have a house, you could have friends, you could like, if you don't have it but, the chances are actually, like, if, like, you probably don't have friends if that's the place you're at, but the point is that relationships are everything, and for health, for sure,
yeah,
uh, and and it's funny because for a long time, people have said, "Okay, well, emotions and, like, relationships and stuff, that's, like, one thing, but, like, we need to stick with the tangible." But they do have a tangible impact on, for sure, human beings and definitely I guess, the people in the later stages in their lives. But, I know, for example, that my grandfather, my mom's dad, sorry, yeah, my mom's dad was tough as nails his whole life, and he was living by his own. My grandmother died 25, 30 years ago, and he didn't even go on a date since the day she died. Like, he was like, "My
oh
wife
my
I got
gosh.
married." But, he lived alone, and he took care of the house, and he was a professor, and then when he retired, he still kept ta he would come to our house to help take care of our house, and then I think when, like, 91 or 92, he had a stroke, and the second he
Oh,
stopped being able to take care of himself, and the second he stopped being able to go to the supermarket and get his own groceries, he used to walk 3 miles a day at 90 years old, you know, and the second that the relationships and the independence faded away, he was like, "Check me out." Like, you know, "I'm
I
not
know.
that this
I'm ready
isn't what
to
I'm." Yeah, exactly. I
yeah.
this is what I'm here for, and you don't wanna be a burden. That was the other thing, and, like, to feel like you're a burden is terrible, and the truth is that you said something really, really awesome at the beginning of the podcast, which is that we go through, like, different stages in our lives, and the later stage of our life is to you know, aside from enjoying, is to be the wise people for our family and for the community and the world around us, and to say, "Hey, we've lived through a lot of this stuff, and you don't need to do this way, and you don't need to go through this pain and this hurt, and you don't have to do this." And, like, when you have that, like, that gives you a reason to exist, that gives you a place in the world. My grandfather, when he was a doctor, he aged 10 years the year that he retired, and it was, you know, it was heartbreaking, but
Yeah.
that's, you know, the way that life is.
Yeah, I was at a meeting tonight with a couple of the older doctors in town, and one's like 68, the other one's in his 70s. They're working, and like, we still love to work. I'm like, good, stay in
Yeah,
it.
don't
And this is,
yeah.
these old school docs that I'm like always just so inspired by. But again, that's kind of what I talk about in my book as well. It's like this sort of, I try
Tell
to
me
really
about your
honor
book.
my
Let's talk about your book
patients.
now. Let's talk
Yeah.
about your book
So
now.
well, okay. So I wrote this book called Life, Love, and In Between: A Geriatrician's Journey Through Aging and the Meaning of Life. And it started out, I was speaking at a women's conference in 2016, and it was it was supposed to be like a motivational talk. And I had just lost my son to a congenital heart defect a few months earlier. So I'm speaking at this conference, and I kept thinking, like, what am I going to talk about? Like, I've come out on this other side, of having a child who was in hospice, and, which is, I kind of, like, always think the universe, like, puts things in front of, like, I kind of felt like our son James, like, had like, we were meant to have him because we knew how to take care of him, it's the things that we did, based on, managing patients at the end of their life or doing the critical care things. But also it taught us, like, how to be better human beings. Because for the first time, when, like, I had to give him morphine when he was short of breath in hospice, like, I freaked out. I was having a hard time, yet I realized I so comfortably write these scripts for morphine for my hospice patients, and then it clicked, like, this is hard for people. So he helped me be a better human, I think, a better doctor. But anyway, so the talk was about my experience and how I went through that whole stage. And what really got me through it was the lessons that my patients had taught me. And what I was talking about in the book was, I get to sit with these people. I don't have like one mother, one father, one set of grandparents or whatever. I have many every day. And I almost feel guilty because they pay me to take care of them, but I almost owe them more. But the book talks about, like, how fragile we are and how much we need to appreciate our lives. And each chapter has a theme and has stories from my elder patients and the lessons that I learned, like about love, just the stories of how these people are meant to be together and how they're together for decades, and finding the spaces in between and not taking advantage of the time that we have, or the thought of empathy and transparency. And so this is all of these themes, and not, really not lying to yourself, not lying to others. And the very last chapter of the book is called Relevance. And I was sitting with a patient, and this person has been my hero, and they're very sick. I mean, almost dying. And they looked at me one day and I said, I no longer feel relevant. And I just, and I, now I know these people like so intimately. I think I spent so much time with them. And in my head, I was like, I can't handle this anymore. So I started to like, I pulled like my Eckhart Tolle stuff out, and I have things in there from like philosophers on failing, like Pima Chodron, and so there's a lot of it's poetic, it's philosophical. But I thought about it. I thought, okay, well, so what happens when I'm no longer a doctor, and I'm no longer a mother, and I'm no longer a wife? Where do I find relevance when all of my labels have been torn away, and how do I sit with myself and I'm still relevant as this human being, so the book, I think I'm hoping it teaches people these wonderful lessons that I've learned from my elders. It tells a little bit of about my story and my upbringing and then the way I met my husband, and that was very special. But at the very end, it says, you know what? If you want to learn anything about this world and about surviving this world and living a better life, just sit with your elders. Just sit with them,
Yeah.
and they will teach you all the lessons you need to know. And it seems like you sort of have some of that in you. You have your grandfather's stories, and you seem
I
to.
love old people.
Do you love old people? I
I
love
love
them too.
old people. I'm an old soul myself, so like,
Yeah.
for example, I used to visit the assisted living homes in college and organize, have students, organize trips I've always been an old soul as far as, music and culture and stuff, so we'd sing like Frank Sinatra and we'd sing some of the
Yes.
classics and, we'd hang out, we'd have birthday parties in the assisted living homes, and there's, the sweetest woman named Ruth, and I remember her she's super, super, super short-term memory loss, but was in incredible physical shape.
Yeah.
So she was always bouncing around, looked great, and she would ask me we would have the same conversations 30 times in half an hour, and I would and she'd be like, "So what do you study?" And I'm like, "Creative writing," and she's like, "Cool." And she says, "So what are you studying?" And I'm like,
Creative
"Astrophysics."
writing.
"Oh, that's amazing."
Yeah.
You know? Yeah, I
Pretend
got
like you had the first conversation every time, which is okay.
But
Meet her when
but I
she where
learned
she
so
needed.
much. You learn listen, there's no I always grew up, I grew up Orthodox Jewish and one thing that we always had was just like, the I guess the Jewish perspective is that the older the people are, the closer they are to the original source, and
Yeah.
so respect that they deserve? So we didn't grow
Yeah.
up looking at old people like they're irrelevant. We looked at them like,
Like
they've
the
got to know something.
spiritual
Yeah,
source,
exactly.
yeah,
They've
the
lived
the
their
source to,
life. They
like,
know.
this is where you
Yeah.
get your enlightenment from. You hang with them. Yeah, and, I you talk about so a friend of, my best friend when I was 13, I talk about her. Had always wanted to write about her, but, Alma, she was 80 and I was 13, and I used to always go to her house. So I was never in trouble because I was always at Alma's house, and, we used to watch Dr. Zhivago together, and she used to tell me, she was like she lived in Germany during World War II, and so she told me all about just everything she had witnessed and experienced, and, so I have stories of that in my book too, and but she taught me about love. She was always like, when and her husband had passed, but she was like, "The love you have when you meet, like, your husband is going to be so different than any other love." I mean, and it was just like, and I remember, like, when I first met my husband, I was like, "Oh, that's what she was talking about.
Uh-huh.
That's what Alma was
You don't
talking
know
about."
until you know. You don't know
Yeah.
until you know.
Well, my friend Mel, she's been reading my book, so I was telling you earlier, she wrote this thing and said, "Oh, like, dear God, lady, I just finished chapter 2 in tears. This is so moving. And then do not tell Jace, but I secretly like him as a human now." Because my husband comes across as this, like, very just stiff, like, he does what he does, but I have these other parts of him that nobody else does, and I think in the book I show that this other human that nobody's used to seeing, this other incredibly wonderful, soft human. Um, but yeah, so I hope people like the book. I really wrote it for, caregivers. I wrote it for anyone who's struggling with aging, and I wasn't even sure like how it was gonna go. But I just felt like I need to get these words out, and I need to be as, like, poetic as I wanna be in it because all I'm used to writing is, like, medical things. So
Yeah.
this was
Exercise.
definitely a lot more fun, and it was heavy, and it was also therapeutic too. So, and I thought, "You know what? If it becomes a great book, it becomes a great book, and if it doesn't, that's okay too." It was just my way of honoring the people that have given me so much. So, yeah.
I wanted to and this is please, as much as you feel comfortable with or talking about, but you mentioned that you lost your son, James.
Yeah.
Um, what can you said that that he had a heart condition? How old is he? What happened? As much as you're comfortable with.
Yeah, no, I'm pretty comfortable talking about it now. It was 10 years ago. He would've just yeah.
I'm sorry.
Um,
It's one of the
well,
hardest things you could go through.
it is, but, I think it was also one of those lessons that helped me see another side of medicine, and it also helped me see another side of humanity because, I
Mhm.
have always been super, like, pro-choice and doctor-physician relationship, and, so when I was it was my 3rd child, so I had Mila and Zoe, and then, we had James, but I went to the hospital to get my ultrasound. I was so excited because I had the other 2 in medical training, so I didn't have a chance to, um, like, do all the fun pregnancy things that moms get to do. As I went there, and all of a
Things
sudden, the radiologist came and was like, "Your baby's heart, like, the apex, so the side of the heart is pointed to the right. It's supposed to be pointed to the left." I was like, "Where are all the other organs?" And everything else was in the right place. So anyways, he ended up having this very severe congenital heart defect called heterotaxy, and they said that, he was fine as long as I carried him, but when he was born, he would have, days to months to live, and then we could opt for some surgical procedures that were going to be palliative. He would have always been sick, and, and then if he lived to 2, he could have tried to have a heart transplant. Well, I think my
Mhm.
husband and I had so much we read a lot, and we did a lot of research, and I think a lot of, like, soul searching, but when we met with the cardiologist, they were sort of surprised when we said first they were like, "Well, you could terminate the pregnancy." And so here's what's interesting, here you're like Y it's like these decisions that people have to make about, like, life and termination of life, and all this stuff sort of came into it, and I was like, "What are you talking about? Like, why would I terminate my pregnancy?" They're like, "It's
Yeah.
not about" I'm like, What the heck are you talking about?" Like, so, we carried him, and then they thought because I was gonna continue the pregnancy, that I was gonna do all these medical things, and then I was like, "What are you talking about?" Like, I'm not gonna let him suffer. I can't do that to him. And, so we took him home, and, the only time I saw my husband cry was, our pastor came to the hospital and baptized him there because we didn't know how long we had. That was
Mhm.
that was really awesome, and then, we took him home and 8 weeks. So he lived 8 weeks, and he died at home, and then it just I think I learned so much about myself, and I learned so much about, how I need to be sensitive in a different way just because I perceive things in a certain way as a physician. So I think he definitely changed the way I practice medicine, but then also, like I had said, my patients had sort of prepared me for all this, all the lessons they had taught me, and, w after he had died, sometimes you question, like, "What did I do? Did I do the right thing? Should he have done all these surgical
Mhm.
procedures?" And I ended up talking to a mom who had had a kid who had heterotaxy who passed away, and she just started crying, and I said, "Are you okay?" And we were just talking, her son passed, my son had passed, and she said, "I did all the medical things, and I spent so much time being his nurse that I never got a chance to be his mother, and you had
Mm.
every minute you spent with him you were his mother."
His
And
mo
we did. We took
his
him on hay rides. We to see the Easter bunny to the bar with his cousins, his little 4-pound baby, and we're like, I'm like, "You're gonna live it up. I don't know how long you're gonna live, but you're gonna live your life up, kid." And, it was really cool. It was incredible. And then, yeah, and you also learn how much, I learned how much my husband loves me because we were at the doctor and they were like, "Well, you shouldn't have another pregnancy because you have these complications." And I'm like, "Well, we could probably have another baby after James." And he was like, "She will never have another pregnant." When he thinks like he thought my life was at risk. And I was like, "Wow, he really loves me. That's so sweet." And but then we got involved with foster care, and after that, and we were doing respite foster care, and somehow again, like, life works out the way that works out. We ended up with Peyton in our life, and we were able to adopter, and, so I ended up somehow with 3 anyways. And,
Beautiful.
you just kind of you like, just I think that's the other part that, I talk about in my book too, is, like, I had just planned my entire life out since I was 6, like, "I'm gonna do this by this time, and this by this time," and even if things didn't work out a little bit, I still figured it out, and everything still stuck to my calendar until, like, the world, God, and everything, all the powers that be were like, "No, no, life doesn't
Yeah,
work out that way. You go with the
yeah.
flow." Like, you have to, you can't do that, and that was, it took, like, 37 years for me to have that lesson, which was pretty incredible. I'm kind of thankful for it. But, but even now, and I think that it just changed who I am. And yeah, I don't sometimes I'm, like, so inappropriate because I was in a patient's room the other day in the hospital, and I'm wearing jeans because they end up in the hospital. I just went because I didn't know, and I had my feet on the bed, like, my legs were up, and the nurse came in, like, "Who are you?" And I showed him my doctor badge. I'm like, they thought I was the patient's daughter. I was like, "Well, I kind of am. I'm their advocate. I was checking the chart, seeing what was going on, um, and then, yeah, he helped me, I think, be more human than any other time in my life. So I just let things go now.
Incredible. Incredible. It's incredible that you can that you I mean, I mean, I don't know what the alternative is. I know what the alternative is, but, I mean, it's incredible that you're able to turn it into, meaning. You're able to turn it into something tangible that you take with you. I did, no, I guess I did a breathwork class. My wife had encouraged me to try one,
Yeah,
and it was more of that, like, like, breathe out until you,
yeah,
nose in and then exhale, and I've done psychedelics before, so I was a little familiar with, the kind of place that I was supposed to end up at,
yeah,
and, uh, and I at this point, I'd been a father. This was probably a year ago now, and I'd been a father for 2 years, and I was still struggling with the idea of me being a father, and, like, I was not I don't think like, I still thought of myself, and I'm still transitioning in my head from thinking of myself as, like, a kid and a teenager to being, like, a dad that's responsible for 2 kids right now and a home and a wife and a family, and, uh, and my grandfather had just passed away, a couple months earlier, um and I was doing this deep breathing, and I swear to God, I felt his soul. And he was like the father figure kind of role in my life. My dad, who I work with, I'm very, very close with, is always more of like a friend.
yeah,
And he didn't like he wasn't the authoritative father figure that like you look up and say, like, this is a dad. You'd be like, oh,
yeah,
this is my dad. I love him and
yeah,
he's fun, and he's cute. My grandfather was like, like this Holocaust survivor and like, strict but loving and has priorities set straight. So, you know, I'm doing this breathing and like he came to me and I was just like sitting with his presence and it just helped me process for a minute like, hey, like, he was scared, and he made it, and you were scared, and, like, your life is a total breeze, and, like, you're gonna be fine, and, like, he's with you, and, like, you have the direction, and you have the people, and, like and it almost felt like it almost came to a little bit of some kind of resolution, some kinda, like,
yeah,
spiritual resolution that I really, really felt like, and I felt like, he had to be acknowledged that, like, he behaved a lot of the way that he did a lot of the time because he was afraid and frustrated, and, I had to come to the conclusion, like, I was a fearful kid, and I don't have to be a fearful kid anymore. I could just be a dad now that, like, learns from his grandfather how to be a dad, and, like, you learn s and what's incredible is you've taken that lesson from, the elderly community and applied it to your life in a child, and child, like, like, which you would imagine is the total opposite, but I feel like the wisdom is so deep that and they have to cross, like, they
yeah,
definitely they flow into one another, and if you're willing if and you look at and it sounds like you've been able to accept it from either end, from learning from the youth and learning from the elderly, and it's, uh, it's extremely, extremely admirable, and it's really, really beautiful to be able to, just even listen about and hear about. So, I really, really I give you so much credit for choosing to handle things in the way that you do.
But, it's really interesting being on this podcast with you because, like, you're like, you're obviously, like, younger, yes, young family, and, but, like, and culturally, like, after having this conversation with you, like, wow, we are, like, a lot alike, as far which, um, like, I think, like, we've lost that. Do you know what I mean? Like, I wish we would have more of that, and I love that you can talk about this because I do think, like, you being younger, you can definitely be, like, this amazing role model for your peers, because, like,
I know if I'm a role model. I'd
you
encourage
you
them to
can
be.
be though, it's
I am. I'm just a regular dude. I don't think of myself very highly at all. I think a lot of
but I
people are
mean,
more
but,
capable than
like,
I am.
it's like when you're someone who's, like, relatable, like, if someone who's
Right.
like, "Okay, no, like, I can relate to you in this sense," just like I think, um, m like, mid-career women who are struggling with some of the same things I'm struggling with can, like, relate to me, and it's like so, but what's cool is every stage is, like, beautiful, and every stage is just, like, embrace it because you're gonna lose it, even with your babies, like, oh my gosh, like, I I keep looking at Mila's pictures when she was a baby, and I'm like, "Oh my gosh, I've got this, like, big teenager that's taller than me," and, like, where did that go? So, yeah, I don't know, I feel like our life is so short, and we're so lucky to be alive,
Yeah.
and we're so lucky to get to experience life, and I think we shouldn't take it for granted. I think that's what elders teach us, you
Yeah,
know?
and I think it goes hand in hand with everything we've been talking about. When you love your life, you wanna take care of it. You wanna
Yeah.
cherish it, and, like, I mean, I had friends that just came over, and they're a little bit helicopter parenty their first times, and they are, and, like, we understand, like, you don't want that person to get hurt. You don't want it,
No.
and, like, you wanna protect them, but at a certain point, like, there's a great book, The Anxious Generation by Jonathan Haidt.
Oh,
I don't
it's
know if you
such a great book. Yes.
say it's the most important book I've read other than any religious book I've read. I like that book is, like,
It's
awesome,
transformational. It's a fantastic book. Yes. I read
and I think
another
everyone
book
should
by
read it.
him. I mean, he's an incredible social psychologist, but what was the other book he wrote that I read first? But he's incredible. Yeah.
He wrote another book, another favorite, yeah, he wrote a book, The Coddling of the American Mind too. Um,
That wasn't the one I
and
was thinking about. Something maybe I was thinking about the Dan Ariely book. Anyways, like it's hard to remember which one, but
uh,
he's
yeah.
so smart. And he's so right on. Like 10 years ago, I was like telling my in-laws, like, don't let Mila on this phone. It's gonna give her ADD. And now you're like, see, I told you, all the studies are out. Too late now. She has her
Yeah.
phone.
That's it. It's gone. It's gone.
You
I
know?
have it too. I have it too. I've been hit. I've been hit. I'm addicted. I'm addicted for sure. I
Yeah.
wanted I wanted to I wanted to ask you because my wife was really excited when I was preparing for this. I was talking through I was going through your website with her, and we were talking a little bit about deprescribing because I think
Yes.
that mm, we talk about the American pharmaceutical treadmill that people are on, where you're always on it and it keeps on chugging along, and, like, no matter what you're doing, it's just always tacking more on. It's never
More and
taking le
more.
Yeah, exactly, and so, how do you go I'd like to hear how you go about deprescribing, um, and I think that a lot of this stuff does not just exist in a vacuum. If it applies for geriatric, I'm sure it applies for, young adults. I'm sure it applies for middle-aged people. I'm sure it applies for youth. So, what are some things that you've learned about the process of, deprescribing people and what replaces that?
So when people this is how I see medicine. You're like in your 40s, your blood pressure goes a little high. You start to get a little blood pressure medication, and then cholesterol goes up and you get a little bit of a my middle child just walked in, but your hey Zoe. Your
We're all good. Yes.
okay. So in your 40s, you take a little bit of medication, another one for cholesterol, and then your blood sugar goes up. They give you something else. And then you have a side effect from the cholesterol medication or the blood pressure medication. So you get on something else, that we call that the
Mhm.
the prescribing cascade where you end up on another medication for the side effect. So like on a nausea medicine now because you have nausea from another medication. He's like the time you're like 60, you're all of a sudden on like 6 to 10 medications. And we consider polypharmacy is when you take a lot of medications and there's like over 110 definitions of polypharmacy, but the most common one is 5 or more medications. And as we age, the way we take a medication and the way that medication is distributed, the way it's metabolized and eliminated from our body changes because our body changes. Our
Sure.
skin changes, our kidney changes, our liver changes. Um, and so we have to, as a geriatrician, we have to think about, well, is this medication still appropriate? And so when I see a patient, is this medication still appropriate for their kidney function? Is this medication still appropriate for like primary prevention? Is the risk of prescribing it, is the benefit outweigh that risk? And thinking about side effects that they're experiencing. And I kid you not, I had a patient in my office who came in who was testing in like the moderate dementia stage. I took her
Mhm.
off of half her medications over a 6-month period, and she tested in the normal cognitive range.
No.
So she was,
No.
and I mean, this was like the classic. I cannot believe so she was able to drive again, and she was about to
What?
move in with her son, and she was able to go back home. I mean, I've
From deep prescribing?
yes, and I think and then some of these are like extreme cases, but we have to really be as a good doctor, we think about prescribing, but we have to equally think about deprescribing. Now, when we think
Yeah.
about younger people, so if that young person, before they were placed on their blood pressure medication, what was the reason for their blood pressure issue? Was it because of their weight? Do we need to think about weight management? Is it because of, stressors in their like cortisol levels? Is it because of hormone levels? Like you have to kind of think about this person holistically.
Mhm.
Is it a genetic factor? Is it a kidney factor? So really thinking about that. And then if we can sort of address the underlying issue before we prescribe that medication and see if we can get and achieve the goal that we need without the prescription medication. And sometimes we need the prescription medication. I mean, medicine is cool. We've created all sorts of awesome things, but sometimes we go overboard. So, like the cholesterol example, can we lower the
Mhm.
cholesterol by thinking about a more plant-based diet? And anytime people are like, "Well, I can't be a vegan," or I would tell them, "You need a ketogenic diet." And they're like, "I can't just eat meat." And I'm like, "No, my husband is a vegan and he eats a ketogenic diet." Like, it's not about meat and it's not about, he gets plenty of protein. I
Mhm.
can't. I eat fish,
What
but
does he get from protein? What does he get for, what food does he eat for that?
so lots of soy, like I would say tempeh and like lots of beans, and I make like these alternative common foods. Like I'll make like a falafel, but it has like walnuts in it and
Nice.
nutritional yeast and and I'll it's baked and not fried and then we eat like very good good oils, not seed oils,
Sure.
those are inflammatory.
Avocado.
But yeah, like great, like good olive oil, like it's yeah, I mean that's a lot of a lot of lots of nuts and sometimes I'll make stews and mix a lot of nuts in there or it's and my elder patients they're like I'm going to go vegan. I'm like you are not going to go vegan because you are going to get sick. We have this takes many years to to get to a place where you're meeting your macro micronutrients. But I can help you get more plant based, and still maintain that and lots of vegetables and it's not hard. But it is hard. You have to have like someone who's patient with you. And so like I had a guy I'll kind of leave you with this big one, but came to me depressed because wife had died, didn't know how to cook, was like 304 pounds, this sweet man. So didn't like had gained all this weight. Diabetes was out of control. Blood pressure was out of control. And I told him, I said, listen, we're gonna make some changes, but for the next 3 weeks, every time you go to the grocery store, I need you to call me. I'm gonna show you how to read food labels." So we did. I showed him how to read food labels, how to prep food, how to make food. So over 2 years, he went from 304 pounds to 240 pounds,
Do
and
you
that
have
was a
that
hu
blog? Do you
Hmm?
have that, like do you have this process on your blog? Like, do you have this, like, in a commonly available, accessible way that, like, anyone could, like, take a look at this? Because, like, we care about I think the generation cares about health nowadays. They really do.
I know, I love that too. So I'm writing this book because all this stuff is like kind of mishmashed in my blog post because and the blog posts come from a patient asks me a question and I'm like, oh, I need to write about this.
Mhm.
I gotta make sure they have access to this information. And then I'm in the office and I'm like, oh hey, you need your omega 3s. Here are your plant-based omega 3s and here are your animal-based omega 3s. And I'll print out the thing. Here's the blog post. But, I'm writing this book now. I'm actually on the very last part, the H, the habit. So I try to, like, package it all so it is in this, like, sequence. But yeah, you can find, like, all this information on jerryacademy.com. And then the blog's not for old people. It's for everybody, who thinks about their aging, and we should think about our aging in, like, our 2nd, 3rd decade of life, not just
Oh,
like
yeah.
when we're
I think
50 and
that all the
60,
time.
we've lost all that time, you know? So I love how younger people are thinking about it. I mean, my 15-year-old measures her food. And kind of obsessively, but in a really healthy way. She makes her lunch every day, but makes sure she has like she measures everything that she puts in there, And I'm like, this is kind of good. Okay, maybe like the OCD parents, the type A parents have, uh, you know,
The impact.
done that to her, but it's
Yeah.
okay. But yeah, all of this stuff you can find it in the blog. There's like healthy things and I keep adding more to it. But yeah, I'm hoping well, I have to find like a literary agent first for this book to see if I can get like what as far as like publication goes, but I just was like, I got to start writing this.
Yeah,
And
for sure, you should.
but all the information's like in bits and pieces in the blog. You just like look for the thing you want to look up. But yeah, he got a dog. He ended up walking. He ended up moving closer to his daughters. Like this was all transformative,
Yeah,
after
it's
losing
huge.
60 pounds. And he was continuing to lose weight, but um, it wasn't hard. Somebody just needed to teach him what to do.
It's awesome.
So
Yeah, I totally agree. I have a group of dad friends around here and, where I live, and, um I have one particular friend who since I met him a couple of years ago, probably lost 150 pounds without exaggerating. And no one ever, like, told him that he was overweight and, like, he never had like, he told me he had a doctor was like, "Hey, you gotta be careful." But what happened, I think, was he became friends with me and a couple other guys that do exercise a lot and just talk about it,
yeah,
on a we just talk about it, and, like, we talk about how good we feel and how it's part of our everyday schedule, and then we have a group chat, and and then he started sending, like, the videos of people jogging, and, like, so one day, like, on a random Tuesday, someone sent a video of them jogging, and then within the next hour or 2, everyone else sent a video of them, "Hey, you know what? I have 20 minutes now, let me get up and let me work out for a little bit," and, like, I
yeah,
think that community is also such an integral part of health as far as building habits and encouraging healthy habits because a habit, is hard to build when you're kinda swimming against the stream, but when it's your norm, then it's like, hey, you almost wanna do it. Like, I mean, all the and you could talk about the motivation and the value or not and how much intent matters or not. At the end of the day, if someone's losing 150 pounds at 35 years old, that's awesome. Like, I don't
yeah,
if you're doing it with your friends, you're doing it, you guys are laughing, you're doing it, you guys, agree that, cutting back on drinking for, drinking X, Y, and Z is probably beneficial. The way you eat, probably beneficial. Stop eating at particular restaurants or particular types of food. And like, and we just feel everyone is just doing better now than they had before, and their lives are crazier. It really
yeah,
helps with balance for sure.
yeah. Like we love craft beers, and it's really cool that
Yeah,
there's all these like
you're the
non-alcoholic
best place
craft
for
beers.
it.
Like
I
it's
want to
the
tell you about
experience, and I
Asheville.
every time we go somewhere, like now we
Have
are
you
like,
been to
oh, let's
Burial?
try the non-alcoholic craft beer. Oh, Asheville's like the best beer place ever. It's
Have
good
you been
stuff.
to Burial?
Which
Do you know
one?
where that is? Burial?
Oh, yes, Burial's close to me. Yeah, it's
It's
great.
incredible. I get beer shipped from them down to South Florida. I make my dad go there to pick up for me. He has a log cabin near there, and I make him go to
Oh my god.
Burial and ship me beer.
Oh my gosh. Yeah, no, we love it. I mean, we love craft beer, but that's kind of really cool because the whole, like, shift because it's just kind of like an experience, and now they make all these, like, yes, amazing like, Sierra Nevada has a whole bunch of really
Yeah.
yummy, non-alcoholic beers, but a lot of,
They're right near
gosh,
you guys, right? Voodoo Ranger, Sierra Nevada, it's the same company?
um,
I think
yeah, and then who like, Hillman
Liquid
Brewing I
Deed.
mean, there are so many
There's the Brewery District.
awesome.
It's aw I
Tarkwa, we are
love
like
Asheville. I love
oh, it's
Asheville.
such a cool like, and then that's like our weekend we're at a brewery with our kids and there's like music and we
Yeah,
just chill
of course.
out and it's good. It's the culture's good. But again, like there are ways to live healthy now. And they're just like, if I have one beer a week, okay. But then if I want something else, yeah, like my husband only drinks non-alcoholic beers now. He's just kind of given up alcohol
Way healthier.
completely. I still do like a glass of wine a week or a beer once a week or something. Just
That's good.
you know, meh,
Once
what are you
fine.
gonna do? We have our
Once
vices and then we reset again, right? It's
Yeah,
the
definitely, definitely. You guys have
so,
great
yeah.
music there too. You guys have an awesome music scene there. Billy Strings just played 3 nights there. Oh,
I know
man.
my nurse went every night.
No
She thought
way!
it was that she got tickets every night, and then, what did I just do? Oh, I just bought tickets to Lollapalooza to take my 2 daughters in Chicago.
Man,
Yeah, I was
good
on
for
the on
you.
the website today trying to get the tickets, and then my oldest was like, "I can't go. I have volleyball tryouts." I'm like, "Okay." I already bought the tickets, so I'll sell it when I get there. It's like, "Really?"
Wow, so
I
cool.
know.
It's a great place to live. How long have you been in Nashville for?
We've been in Asheville, let's see, like, since 2020, but I was only, like, an hour away, and then we've been in North Carolina since 2013, so
So my dad has a log cabin about half an hour from Burnsville, which
okay.
is Tennessee from you guys. The
Yeah.
closest city to him is Johnson City, Tennessee.
It's only, like,
That's
an hour from us. Yeah, it's
Yeah,
close, not far.
yeah,
Yeah.
totally, totally, and we and when I was yeah, during COVID in 2020, my it was this log cabin, no one's around, it's the middle of nowhere, and I used to go with my and I was like, "I'm sick and tired of being locked up." So I would take a group of friends and, we'd go take 5 or 6 of us, we'd go to the cabin and go into Asheville during the day and then go back to
Such
the
a f
mountains at night. It's awesome, I love that part of the
it's it's such a fun, different place, and, like, anything goes, You go downtown and somebody's just doing yoga and like, everybody else walking. It is just like a wild just and people are just so I don't know, like, everyone is so helpful and kind and I
Was
think
there any area that was affected by all the flooding?
yeah, it was that was hard. That was awful. Luckily, like, our house was fine, but we didn't have water or electricity for many, many, many weeks.
Right, yeah.
And, I had to close my office because, we had no
Mhm.
running water, and eventually we opened and we were like, "We'll just bring water in," and, it made house calls and it made I mean, it was crazy, and then our virtual assistant, she lives in the Philippines. We made international news. She called us and was like, "Are you guys okay?" We were trapped in our house for
Whoa.
on our street, we couldn't get out for, like, 3 days, and then
Yeah.
we're every nobody was helping, because nobody could get to anybody, and, finally, all the neigh everyone took their, like, chainsaws and cleared the roads so you could get out, and by the time we got out,
Mhm.
we didn't know there was, like everything was shut down, and, um, yeah, it was crazy, and, we ended up getting our kids out of town so that they could go,
Yeah,
and then we ended up coming back to help, do whatever we needed to do. But it was, that was wild. I can't believe we went through that.
that's
Hopefully
great.
the last one, and Asheville's just perfect now because I really do love it here. It's like my favorite place I've ever lived.
That's
It's a
awesome.
good spot.
Yeah, I'm happy to hear that. Yeah, so we've gotten stuck there. If you wanna the truth is that as far as, like, America goes, if you wanna kinda have trouble in America, like, like, natural trouble and stuff like that, like, North Carolinians treat each other so well, and, like, the people like,
Yeah.
we've gotten stuck in the mud so many times or, like, we've broken down or something's happened and, like, the people are just good people. They
Mhm.
just have they just have that goodness in their heart. I
Yeah.
really being around there. Before we wrap up, I wanna ask your advice and final thoughts on things for people to avoid as far as their brain health and development as they age and things for people a couple of things to avoid and a couple of things to proactively take care of and do.
Okay, so processed food, like, avoid it. It is a killer.
For brain health.
It's a tough one, but it's a killer, and everything is now processed, like, just anything that comes out of a box, try to avoid it. Eat fresh foods, I would say, is probably the big thing, but avoid processed food. Avoid not sleeping, that's really, really bad. Make sure you get at least 7 hours of sleep, because lack of sleep, and I struggle with not getting enough sleep, but, insomnia can increase your risk of dementia. Make sure that, don't smoke. Smoking's bad. Don't vape. We don't know all the data yet, but bad things are happening. Like, we're finding bad things. So don't put anything in your body that's harmful. Just like treat your body like it's a temple. Um, try to really like no alcohol is the best thing, but a little, try to don't drink daily because that's not good for you either. So those are the things that I would say. Exercise almost daily, not just cardiovascular. You should probably do weight training. I hardly ever do like cardiovascular stuff. It's like I'm basically doing weight training. And most of the time when you're weight training, you're hitting that zone too. So you're getting your cardiovascular needs met anyways. But yeah, strength training, I think like key almost every day. You should be doing
Yeah.
something to stay active. And then, I think there's some good stuff about fasting. We're
Ooh,
still
for brain
figuring
health?
all that out. But I'm not into this like these big long fasts. I'm still trying to figure that. I know David Sinclair talks about these fasts. He wrote the book Lifespan. He's like so smart. But I'm more of a, "Hey, let your body do a natural fast, so don't eat late at night. Finish your dinner at 6 p.m. Don't eat anything else. Just have some water until the next day before you wanna eat. Eat when you're hungry. Don't suffer, but eat
Yeah.
something good." I mean, those are, like, the basic things I tell
That's really
people.
interesting. That's really
Isn't
cool.
that
So,
what
avoid vaping, uh, processed foods, a lot of alcohol, and, what was the last thing that you said? I think the top 3 we'll
sleep,
call
make sure you're getting plenty of
it
sleep,
sleep, get enough sleep. Right,
avoid
proactive, get enough sleep, exercise, and potentially stretches of fasting in whatever capacity that might be. So from dinner time to breakfast time to dinner time, whatever
yeah,
that might
just kind of, these natural fasts. Eat when you're
be. Does fatty
hungry,
including
don't
water?
overeat.
Does fasting include water or no?
Oh, yeah. Yeah, I think, like, you should just drink as much water as you want. Like, water's key. Even, you can even stay hydrated with some coffee and tea if you're, like, going throughout the day, I mean, as a doctor, like, people are like, "Oh, when do you take lunch?" I'm like, "I don't take a lunch." So all I do is I have, my breakfast, which is sometimes, like, a couple of eggs or, like, a protein ball or something, but then, somebody from the gym makes and some coffee, but then the rest of the day, like, if I'm hungry, I'll have, like, a handful of nuts, and then I get home and I eat, but, doctor diets are perfect. We don't worry too much about weight gain. We just don't really have an opportunity to sit down and
Yeah.
chow down, which is fine.
Yeah.
Um,
Keep
but
busy
yeah.
enough to not get unhealthy, basically is the answer.
Yeah, and I'll put up some more blog posts on, like, specific, like, diet things. I think that that would be a fun, of a good thing to put up. And I always tell people like, don't like follow all my vitamin supplement. It's not advice. It's just information so that you can advocate for yourself, and you can talk to your healthcare professional. And that's the other piece of it. Before my internet knocks out, but if there are only 13% of people have access to a geriatrician. We need 30,000 by 2029 when the last of the baby boomers turn 65, and we only have like close to 7,000. We have those retiring. We only train 250 a year. And so I think healthcare really needs to become like your own, like you have to own it. And yeah, I
Yeah.
do think AI and tech is going to help us achieve some of that where they're going to be a little bit of a lack in healthcare, and people should advocate for themselves and seek truths other than some of the weird, like, weird stuff, that's out there. Like
You mean like to live forever, be like a lizard person kinda thing?
like, drink something urine or I don't know. I'm
Yeah,
just
yeah,
making
yeah, yeah,
stuff up,
yeah, yeah, avoid all the
Don't do
Epstein
crazy
files.
stuff like that.
Avoid all the
Yeah.
Epstein files, oh my
No,
god.
yeah, avoid
Uh,
all that, yeah. Oh my
Seriously.
gosh.
Doctor, this is such a fun conversation, and honestly, I had such a blast. This was an emotional roller coaster, but so informative and so much fun, and, quite frankly, this was awesome, and you killed it, so thank you so much for
Oh,
taking
well,
hopping on.
thank you, and then, yeah, I'm gonna connect with you because I do want one of those, like, bone density machines I was looking at, so
Oh, definitely.
yeah,
Well,
like, maybe we can connect. Hook me up.
definitely,
Alright.
definitely. I'll do what I can for you. Doctor, thank you, of course. Thank you. Have a
Bye,
great
Brim, thank you.
We said goodbye, but before we go, how do we find you?
Okay, so, you could check out geriacademy.com, Geri, academy.com.
Mm,
It has a link to my book if you're interested, and then the book again is called Life, Love, and the In Between: A Geriatrician's Journey Through Aging and the Meaning of Life. So,
and I'll put that
there you go.
link on the website and, on the episode page so everyone will be able to find it very easily.
That
Thank
sounds
you.
great, thank you.
Okay.